I was like literally halfway through nursing school and just had turned 31 in November, and like shortly after the new year, I felt a lump, and you would think that's like the last thing on my mind is cancer. And so I go and I see urgent care, and she says the same thing. It's probably nothing, but we'll just double check to be sure. The radiologist goes, there's just this one little spot I'm kind of concerned about. I don't think it's anything, but let's just make sure.
She is a young woman, was kind of engaged and getting ready to get married, and felt a mass in her breast. And unfortunately, biopsy showed breast cancer. One of the aggressive types of breast cancer. We call it triple negative breast cancer.
We were planning on getting married after like November, December, maybe early January, and that just expedited all of our plans and said, you know what, nothing like the present at this time.
The icing on the cake is preparing for your soon-to-be wife to get cancer treatment, and also digesting the diagnosis and everything else.
The shift from being the helper to being helped changed my whole perspective on how to care for patients. I want to be the one to help people that go through that, because to have somebody that at least semi-understands what you're going through can make all the difference as well, just having somebody there.
Just by reviewing everything that Baptist has to offer relative to other places, and everything else we read, it just was a no-brainer, just to stay where we are, we're in good hands, everything else. Baptist was exceptionally good with crossing their T's and dotting their I's. When there was times of, this may work, this may not, it was, let's get a second opinion. They would push for that.
I brag about my team all the time. Great people to work with. They put the work, the effort, and the hours. For most of them, it's not just a job. They really want to take care of the patient. Everybody is very excited about moving next year to the new campus. In oncology, I think the highlight in the new building or the new campus will be that we will have everybody in the same space. We will have radiation lab, the chemotherapy, the checkout area. So it's kind of a cancer center that will just be one-stop place for the patient, and I think that will make it a whole lot easier for the patients.
Yes, it's going to help so much with just having one floor, one place to do all your treatment and everything, instead of just going for down and up and down and up stairs for treatment when you're exhausted and tired and it's been a long day already.
Just seeing the glass windows and the light inside the building, I think this has a good impact on our patients. Having the space and the trails around the building, sometimes patients have a little bit of time in between seeing physician, receiving treatment. They can grab something to eat and go outside and just have a little bit more room and space. So I think that just all of these little things can help a cancer patient tremendously.
Because of your philanthropic gifts to the Baptist Healthcare Foundation, we are able to provide groundbreaking care to our oncology patients like Anistie. Join us as we continue to transform Baptist for the future. For more information, visit baptisthealthcarefoundation.org.